Okay. So we are just now in Berlin, and the Side TV channel present you John Eckardt. Yes. So the head officer of pharmacological company. May I ask you some questions,
Sure.
especially for Side TV? So, John, do you believe that the modern robust technologies may really greatly improve the results of patient treatment in the clinical oncology? What is your viewpoint?
I think for sure is the advances we're getting now in the ability to understand the different genetic changes, but also how our own body's immune system is reacting to the genetic changes and how cancer cells can actually adapt to that. Is going to really revolutionize how we're going to be able to do for cancer patients. I do believe we are on the forefront of a complete paradigm shift in the therapy for cancer patients.
Yes.
And to illustrate a couple points is that the technology now, not only can we identify these targets, but we can actually engineer both immune cells and actually targets to actually attack the cancer that we've never had before.
Interesting. And you know, the second question, maybe final. We know that cancer is the second, in some countries, third reason of death of the people in these countries. But we know prediction that in the United States, 10-15 years later, it's planned to be 7 or 8 rating position. So
Yes.
due to the modern technologies, do you believe that it's possible?
I do believe it's possible. I think we can get to the point where cancer no longer is the leading cause of death. Ultimately, we're all going to die of something. That's our bodies can only live so long, but I think we can take away the really devastation that cancer is, so that cancer can become under control, that it could be taken care of, so that patients can live their normal life expectancy without the devastation that cancer can be. And yes, I do believe that can
And
occur.
what can you recommend and what can you wish for the cancer patient who is just now fighting with their disease? That's very important.
I think right now the big thing for the cancer patient is to seek out centers that are testing these new therapies, because again, they will become standard of care, but in the next 5-10 years, they're going to have to be studied to determine who's the best types of patients to get these, what are the characteristics of the tumors, and the centers that are actually testing these are going to be the centers that are going to lead the way in identifying the patients and the cures for these cancers. But I do believe it's going to happen.
Thank you so much for this
Thank you
nice
so much.
opportunity and for this interview. Our spectators from Side TV channel will be absolutely enjoyed and satisfied.
Great. Thank you so much.
Thank
Thank
you.
you.
Thank you, John.
Thank